Hi, my name is Kelsey, and I did my project on hypothyroidism. Before I get started, I just want to let you know I have a cold, so don't mind me if I cough or sip from my water. Okay. Alright, so first I want to start off talking about the thyroid gland in particular. So it is a butterfly-shaped gland that is just below your Adam's apple, and it's in the front of your neck right here. So hypothyroidism is when your thyroid fails to produce T3 and T4, which are two hormones that regulate your metabolism and the rate at which your body uses carbs and fats. These hormones also maintain your body temperature, and they regulate your heart as well. So hypothyroidism normally occurs in people over the age of 50, and it increases with one's age, and it's typically found in women. So there's two types of advanced hypothyroidism. So you can either develop an enlarged thyroid or a goiter, or advanced hypothyroidism, myxedema, which is rare. However, when it occurs, it can be life-threatening. And before I talk about the signs and symptoms, I wanted to say that hypothyroidism is on a scale or a continuum. So the severity of your hormone deficiency will affect the symptoms that you have, and normally the symptoms develop slowly over a year. So some signs and symptoms of hypothyroidism include cognitive impairment, extreme fatigue, weight gain, shortness of breath, hair loss, bradycardia, muscle aches and weakness. They have an intolerance to cold and typically show signs of dry skin. And the most important sign and symptom of hypothyroidism is mental health. So many people with hypothyroidism experience depression or memory loss. So as for treatment, there's either medications or surgery. So most commonly, people take medications. So some of the medications either target your T3 hormone or your T4 or both. So some of the medications are listed to the left and below. The most common one is Synthroid, followed by the combo medications like Leotrix, Euthroid, and Thyrola. And then the second treatment typically seen in patients with hypothyroidism is surgery, which is shown in the lady with the right. She got some of her thyroid removed, and by doing that, it can halt or diminish hormone production. Okay, so my client wanted to remain anonymous, but she is female and she's 62 years old. She is 5'6", and she weighs 156 pounds. This makes her BMI 25.2, which puts her in the overweight category. However, she's just slightly overweight. Her resting blood pressure is 131/86, which means she has prehypertension. She didn't report any family history, but she did say her parents smoke. However, she does not. She doesn't have hypertension. Like I mentioned, she has prehypertension. And she didn't say that she had dyslipidemia, didn't talk about negative risk factors, and she said she does not have diabetes. What she did report is that she takes 50 mcg for her hypothyroidism. She also takes blood pressure medication, and she takes 2,000 units of vitamin D. As for physical activity, when I asked her, she said typically every day she walks her dog 10 to 15 minutes, and she also 3 times a day. And she also walks to the mailbox once a day, which is a 10-minute walk from her townhouse. So some of her goals, she said, was to become more active, lose weight, and decrease her energy intake, and increase her energy output. Some of the challenges people with hypothyroidism face, as well as her, is she tries to eat healthy and to engage in physical activity and exercise. However, the effort she puts in, she isn't seeing any results. So, for the prescription that I researched, it said she wouldn't need to have an exercise test because it would start her at a low to moderate intensity. However, if you were going to do exercise testing, I would recommend doing the 12-minute walk test, just because it mimics her activities of daily living. And you could compare the results before starting her exercise program and then 6 weeks after to see if she improved. Okay, so for the exercise prescription, I have her starting off at a frequency of 3 to 4 times a week, from low to moderate intensity. Target would be 60% of her max heart rate, and I would increase her time from 10 to 15 minutes, what she does currently, to 25 to 30 minutes, and I would have her walking or at a slow jog. After 6 weeks, I would gradually increase her frequency to 4 to 6 times a week, which she's used to right now, but I would increase her intensity to moderate, 70 to 75% of her max heart rate, as well as her time. I would increase it to 40 to 45 minutes. And then again, her type would be walking or jogging. So, some special considerations or precautions for her would be to be mindful that you're not exceeding her target heart rate as she's exercising. Also, I wouldn't have her working in cold environments, and I would monitor for shortness of breath or any signs of extreme fatigue or confusion. And then also, I would ask her how she was feeling before starting her exercise routine and also after, which is really important, as well as making sure she's staying hydrated throughout the entire program. So, in conclusion, after 6 months of doing this exercise program, she should see her cholesterol lower by 20%, her LDLs lower, her triglycerides lower, and she should see a reduction in weight, slight reduction. She should also see some improvements in her cardiovascular health, and some additional benefits include improvements in her overall health, her quality of life, and especially improving her mental health. If she should be putting in the work, then she should see improvements in her mental health as well as her physical health. And then lastly, doing this exercise program will give her more energy to perform simple tasks. As for references, I use 3 references from the New England Journal of Medicine, also the European Journal of Endocrinology, and the Journal of Clinical Endocrinology and Metabolism. Also, I use 3 websites, which consist of the Mayo Clinic, thyroid.org, which is very helpful when looking up like information for the disease. And then I also use Livestrong.com. Thank you.